you're awake.
Well, actually, I think the nurse should...
Well, actually, the nurse should find a balance between being focused and personal. A good nurse can stay focused while still being friendly and genuine.
These are all very strong points, class. Now we're going to watch the third clip and try to identify all the communication characteristics.
It takes a team of 40 men to collect the food. But this is the rhino's last...
Sister Rose? Is there a Sister Rose here?
I'm Sister Rose.
Would you please follow me this way? How are you today?
I'm well, thanks.
Good. Right this way, Sister Rose. So, Sister Rose, what's your date of birth?
June 17th, 1937. Ooh, the time is flowing by. Already 72 years of age.
That's quite an accomplishment. So, I hear you have a cough. How long has this been going on?
Oh, since September, I would say that's about the time the students arrive at school.
All right, so since the beginning of the school year, any other symptoms?
Not really. My nose still drips like a leaky faucet, but that's been with me for years now. Since I am a teacher, I'm used to runny noses and the need for tissues all the time.
Are you on any medications for the runny nose? Or a cough for any other reason?
Oh, just some Tylenol for a little arthritis pain in my hip. One time, I was on duty during recess. Little Johnny was running around and tripped. I tripped trying to stop him. Ever since then, I've experienced a little bit of pain. But the doctor diagnosed it as arthritis, and Tylenol does the trick.
I'm so sorry to hear about the arthritis. I'm glad the Tylenol is working for you, though. So I have just a couple more questions. Have you ever smoked before?
Oh, well, back in the day, before I became a nun, mind you, there were no warnings about the dangers of smoking. In fact, I used to have a smoke with my parents every now and then. I must admit, occasionally, I have a cigarette after a stressful day with the children. It's not so much that they're stressful children, but it's just a nice way to unwind after a difficult day.
I see. Well, Sister Rose, we have lots of programs and plenty of information I can get you on how to avoid smoking altogether. Would you like me to gather the information for you?
Thank you, dearie. I would most certainly like to think about that.
You're very welcome. My last question for you has to do with allergies. Are you allergic to any foods or medicines?
I personally do not have any food or medication allergies. I do, however, know that my mother was allergic to peanuts. I love peanuts. I'm lucky to not experience any allergic reactions.
You and I both. Let's keep our fingers crossed. No allergies pop up in the near future. Sister Rose, do you have any questions for me before I leave?
I don't think so, dear. If any arise, I'll simply ask the doctor. Thank you very much.
All right, Sister Rose, if you don't mind waiting here, the doctor will be in shortly. I hope you have a great day.
Thank you, dearie. You as well.
All right, class. Now that all three clips have been shown, what have we learned about communication skills of nursing in both professional and unprofessional manners? Excuse me. Are there any certain aspects of communication that a professional nurse should possess? And what makes a nurse unprofessional? Oh, Bertha, yes, my dear.
A professional nurse gathers background or personal information of the patient in a private setting, so the patient's privacy is protected. They also stay focused on the task at hand, but do not rush the patient. Nurses need to be friendly, but maintain professional boundaries between themselves and the patient.
It is also important to actually listen and acknowledge what the patient is saying, and not to minimize or ignore. Restating what the information from the patient also indicates that the nurse really values what the patient is saying and making sure the information is accurate and clarified. This method also helps to stay on task because it brings the patient back to the topic of discussion.
Very good at depicting the professional communication skills of a nurse. Does anyone else have something to add or something to share? Martha, do you have anything to add to the discussion?
I think Gretchen will take this one for me.
Well, the nurse in the last scene appeared professional because she was dressed appropriately. In her scrubs, her hair was tied back, she was not chewing gum, she met the jewelry requirement, she kept eye contact with the patient, and she sat up straight without her feet crossed. You could tell through the whole clip that she was engaged at what the patient had to say.
That's absolutely correct. Overall, students, what are the most important principles that a nurse should practice while conversing with a patient? Oh, Bertha.
Maintaining patient confidentiality,
Listening attentively to what the patient has to say.
staying on the topic at hand.
Restating information from the patient to clarify what you heard.
Also, a nurse should ask the patient if they have any questions.
Wow, all right then. Excellent job today in class. You have all really grasped, well, some of you have really grasped, the communication skills of a professional nurse. Give yourselves a hand.